Hi, my name is Taylor Adams, and this is my restrainer, Jonathan, and this is Lenny, which I've already gotten prior approval to use. I'm going to be discussing in this video performing basic first aid in small animals. I have already watched the instructional video and read the assigned attachment. So first we're going to discuss fractures. So say Lenny has a fracture. First thing that we want to do is apply our muzzle, because a dog in pain, doesn't matter if this is the most loyal, sweetest dog in the world, dog in pain will bite because they're in pain. They don't want you to touch. They don't understand English. They don't understand. You understand that it hurts. So first thing we're going to do is muzzle. Second thing that we're going to do is I'm going to have my restrainer help me. We're going to use a makeshift, move Lenny out of the way. We're going to use a makeshift stretcher. So if you will get the back, I'll get the front. 1, 2, 3. All right, and I'm going to get the front of the blanket, and we're going to lift on 1, 2, 3. There we go. There. So now he is up here. I'm going to get my restrainer to come back here and just hold Lenny down. Hold his head down. Okay. And first thing that we can do is we're going to place a modified splint to prevent the fracture from moving. What I could do is place my tape, and which would help the bandage from not moving. I'm going to start distally, which is what you always want to do. I'm going to take my cast padding, and I'm going to do 50% on the old and then 50% on him. And I'm going to go all the way up. Then I'm going to come back with my rolled gauze, again, distally to proximal, leaving the toes exposed. And again, my restrainer has a nice hold on Lenny so that he will not move any further to injure us or himself any further. Going around. Alright, now I'm going to go back with my vet wrap. Same thing, distal, proximal. Alright, then I'm going to take my pen and I'm going to date and put my initials of when this was applied. It's just a good habit to always get into. And then we can, from here, go through and we could apply a splint. Key thing to remember here is improperly placed modified splint could actually do more harm than good. So if you don't feel confident in what you're doing, always make sure to come to a veterinary clinic. Second thing, we'll be discussing bleeding. Okay, so hands off. Here's one. Main thing to keep in mind with bleeding is all of a sudden we get an incoming call that a patient is coming in that is bleeding. They don't know how. We just know that it's bleeding. So, best thing for us to do is get our gloves on, because we don't know where this blood came from. And to protect ourselves is we want to place our gloves, because we don't know if that blood is solely from the patient or if they were in an accident and the blood is actually from the client, the owner. Gloves. So, first thing we're going to do is we're going to place the muzzle onto our patient, because more than likely bleeding, they're in pain. I'm going to take my I'm going to apply pressure to my wound, and I'm going to be doing this for 3 minutes. I'm going to take my my tourniquet, and an important thing to remember here is with our bleeding, arterial bleeding is proximal to the wound. So if we have an arterial bleed, say my wound is right here, I'm going to want to place the tourniquet up here. And if it is venous bleeding, which is veins, I want to place it distal to the wound. So with tourniquets, the thing to remember here is you want to loosen the tourniquet for 20 seconds every 15 to 20 minutes. If the bleeding has not stopped in that 3 minutes that you have applied the pressure, it's time to place a tourniquet. And you'll know if it's arterial, like internal symptoms are bleeding from the nose, the mouth, the rectum, if they're coughing up blood in the urine, pale gums, collapse, weak or in rapid pulse, you're going to want to keep the patient as warm as possible while you transport them to the vet clinic. That's very important, and get them here as fast as possible. Now we're going to discuss burns. There's 2 types. We have I'm going to remove this from Lenny while I'm discussing it. There's 2 types. We have our chemical and then our severe burns, which can be your 3rd degree. Chemical would be acid or motor oil. The thing to do with that is you want to apply a large amount of water to the burn to continue to flush it. You want to make sure that you're rinsing it off, I'd say for anywhere from 20 to 30 minutes. So a large amount of quantity, and then a hose, and you're just constantly running that water over the burn. Another thing is you want to watch for hypothermia. That could also stop the progression of the burn from healing the skin. When the other type is severe burn, which would be just like a 3rd degree burn. You'd want to use a cold compress, and you can place that on there. A good thing would be to constantly check the patient's temperature, monitor the heart rate, because with using cold compresses, such as something from the freezer, that could also definitely cause hypothermia, which would could also be detrimental. For both burns, the very first thing you want to do, again, is place muzzles, whether it be a chemical or a severe burn. Doesn't matter. It's going to hurt, and the best thing you want to do to safety first, muzzle, muzzle, muzzle. So now we're going to switch over to talking about choking. The last thing I want to do is have a muzzle on my patient. So with choking, I'm going to check to make sure. I'm going to check and see if the animal is breathing. I'm going to check down in its airway and in its oral cavity, see if there's anything obstructing his airway, anything that I could see, and take my finger, careful not to lodge it down any further, see if I could scoop it out. If I don't see anything, then I'm going to come down to the thoracic part of his vertebrae, just like under his rib cage pretty much. And I'm going to reach underneath and take this part, and I'm going to go like this. And a good rule of thumb is about 2.5 to 3 inches of that you want to be pressing in. With the smaller patients, such as a little Shih Tzu, you'd want to do you would apply less pressure, obviously, a good 1 inch, so just less pressure. But since this is a bigger dog, we're going to go like this. If that doesn't work and it's still something's lodged in here, I can take the palm and I can go like this right down here and apply 4 to 5 nice firm kind of beats, and that is basically trying to force enough air to hopefully dislodge whatever has caused him to be choking. Heat stroke. We're going to discuss heat stroke